Welcome to the Great Plains Health Bariatric Surgery informational video. Today, we'll introduce you to our dedicated team and provide an overview of our comprehensive bariatric surgery program. Throughout the session, you will hear from our expert surgeons about how weight loss surgery works and the different types of surgeries available. Our bariatric surgery program is supported by a multidisciplinary team. This team includes bariatric surgeons, advanced practice providers, a nurse coordinator, dietitians, psychologists, and pharmacists. Each team member plays a crucial role in ensuring our patients receive the best care. We will work together to prepare and support you throughout this journey, helping you to achieve your weight loss goals. We'll be answering some of your most common questions about weight loss surgery and guiding you through the entire process leading up to surgery. We are proud to be a surgical quality partner with the American College of Surgeons, accredited with the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. This prestigious accreditation means our facility has undergone a rigorous review process, ensuring we maintain the highest standards and resources for bariatric surgery. In addition, we have been recognized by Blue Cross Blue Shield with the Blue Distinction designation. This designation is only awarded to programs with a proven history of providing exceptional care and results. This reflects our commitment of providing the highest level of bariatric care to our patients. We are proud to have helped a significant amount of patients reach their weight loss goals in our region. We have achieved this through personalized care for each patient. Finding the best place for your care is a big decision, and we will be here with you every step of the way.
Once upon a time, obesity was considered a cosmetic condition caused by overeating and a lack of self-control. What we know now is it is a progressive, chronic, multifactorial disease. In order to have a discussion about obesity, we first have to define obesity, and we use a calculation called BMI, or body mass index, to define it. So BMI basically takes a person's weight and divides it by their height. In order to find your BMI, you could use a BMI calculator or any BMI chart. Using these calculations, we define obesity as a BMI greater than 30. It is further broken down into three classes, class 1, 2, and 3. Class 1 BMI is a BMI of 30 to 35, class 2 BMI 35 to 40, and class 3 or severe obesity is a BMI greater than 40. Each one of these classes carries with it an increase in overall mortality. The World Health Organization currently estimates that approximately 500 million adults suffer from obesity, and we know that over the last 25 years, the prevalence of obesity has slowly increased. This increase in obesity has impacted health in many ways. There are several factors that contribute to a person's risk for obesity, including genetic predisposition, hormonal imbalance, chronic disease, medications, stress, sleep loss, our current convenience culture, high sugar and processed foods, and a sedentary lifestyle. Unfortunately, there are multiple serious health conditions associated with obesity. Some of them are type 2 diabetes, heart conditions, liver disease, lung disease, bone and joint disease, and even cancer. And unfortunately, all of these are associated with a shorter life expectancy. When it comes to medical weight loss, there are plenty of non-surgical options to explore. Medical treatment revolves around diet and exercise and other lifestyle modifications. It also incorporates prescription medications. However, studies have shown poor long-term success with non-surgical weight loss options. The alternative is surgical treatment of obesity. Surgical treatment of obesity includes the lifestyle modifications, but also incorporates surgery. It has been shown to have significant and durable weight loss. Patients typically lose the most weight 1 to 2 years after their surgery. Some patients achieving as high as 70% excess body weight loss, and at 5 years, on average, 50% excess body weight loss. Surgical treatment of obesity has also been shown to decrease other significant diseases that we talked about, such as type 2 diabetes, high blood pressure, and sleep apnea. Studies show that bariatric surgery can reduce the risk of premature death by 30 to 50%. Bariatric surgery is currently felt to be as safe or safer than many common surgeries, such as gallbladder surgery or knee replacement surgery. We must have documented failed attempts at non-surgical weight loss in the past. Patients also must be free from any alcohol or drug problems, or at least be free from them for the last 1 year. They have to be free of any nicotine use at the time of surgery. Mental health is another key factor. Patients cannot have any uncontrolled psychological conditions. Finally, a patient has to be able to understand the risks of surgery. They have to be dedicated to lifestyle changes and a lifetime of follow-up with our bariatric team. All this information will then be reviewed by our bariatric team to make sure that surgery is a safe option for each patient.
In our program, we talk about 2 weight loss surgery options. The primary or most popular being the sleeve gastrectomy and the Roux-en-Y gastric bypass. With normal digestion, food is taken in through the mouth, obviously. It travels down the esophagus where it is stored and ground in the stomach into small particles that can be absorbed. Absorption takes place primarily in the small intestine, and then water absorption, things like that, occur in the colon. In the bariatric surgery changes, we look at decreasing the amount of storage that the stomach has and decreasing the amount of absorption that the small intestine can perform. The sleeve gastrectomy is the most popular surgical option for weight loss, primarily due to the simplicity of the operation. With this surgery, there's a staple line that reduces the size and shape of the stomach by about 80%. There is no addition of a sleeve. It's a popular misconception that we're actually wrapping something around the stomach to limit it. We actually staple the stomach and remove the part that is excluded. This part of the stomach that is removed is the part that creates hormones that often control hunger. So by removing it, the feeling of hunger is decreased in many patients. Gastric bypass, there is a smaller stomach pouch, and that will decrease the capacity of the stomach. The small intestine attaches to this pouch in a way that functionally decreases how much absorption can occur in the small intestine, thereby limiting calories and nutrients that occur that are absorbed in the intestine. When comparing the sleeve gastrectomy and the Roux-en-Y, we obviously look for individual benefits, and this a lot of times will determine what surgery may fit a patient best. The sleeve gastrectomy is a shorter surgery, and because it is a single staple line to reduce the stomach volume, the risk of complications from that single staple line may be smaller than other surgical options. It also does not reroute the intestines and does not alter, for the most part, the absorption of minerals and nutrients, only diminishes calories and creates a alteration in the hormones that affect hunger. In a Roux-en-Y situation, patients may have decreased likelihood of gastric reflux or heartburn. And there are also some benefits for a Roux-en-Y in cases of diabetes, for example, that may cause a patient to decide that that selection is worth some of the other risks. When we talk about comparing complications or risks of weight loss surgery options, we look at short-term risks and long-term risks. The short-term risks for both operations outside of bleeding and infection would be situations like a staple line leak that could cause potential problems in the post-operative period. The long-term risks are much higher for a gastric bypass, thereby making the sleeve one of the more popular options for decreased risks. Long-term risks for the bypass include things like bowel obstruction, marginal ulcers, vitamin deficiencies, malnutrition, possibly even a situation called dumping syndrome, where calorie-dense foods rapidly exit through the intestinal tract With those risks and complications in mind, we have to remember that the overall risks of obesity are significantly higher than the risk of surgery, either the bypass or the sleeve. In reality, in this day and age, almost nobody does weight loss surgery in an open fashion. Laparoscopic surgery changed all of that back in the 1990s when we were able to start using small cameras and thin instruments through very small surgical incisions. Things have evolved to the point now where we're using robotic instruments, and I always joke with people that the robot's not actually doing the surgery. We're still running the instruments with the surgeon's hands. However, when I'm doing that surgery, I'm looking through a three-dimensional camera setup and controlling those instruments. Typically, patients will have 3 or 4 quarter to half-inch incisions at the end of the surgery. When you're considering weight loss surgery, we encourage everybody to look at their personal needs, their personal expectations, medical history, concerns about the surgical options, and we want you to come in and have a consultation where we can sit down and discuss each of these thoughts with you in person. We want you to ask questions and have a discussion with us to make a well-informed decision about your health and lifestyle goals.
It's important to remember we are not a cure to obesity. We are a tool in your weight loss journey. We try to align your goals and our goals together to make a healthier you. We're here to help you along the journey, to prepare you for surgery, to motivate you for that weight loss journey, as well as meeting insurance requirements. First, we have you meet with your primary physician, followed by a psychology evaluation, nutritional education, and any specialty provider visits for clearances prior to surgery. We provide education on lifestyle changes and diet. We extensively look through your chart to make sure your medications and surgical history is appropriate for surgery. As we work through the program, we will be checking your insurance on specific policies. Depending on your insurance, you may have to see your primary physician monthly. We typically have you follow up 2 weeks after surgery. We will go over any post-op concerns or instructions. Afterwards, it's once a month we see you, and then every 3 months. We then follow up yearly to follow any challenges that are occurring with any weight gain versus weight loss. The nutritional and psychology team will continue following to help with healthy maintenance of your diet and any psychological challenges or concerns. We're here to guide you every step of the way.